Months after recovering from COVID, some survivors are still struggling with symptoms.
The University of Kansas Health System has set up a clinic now to treat these so-called long haulers. KCTV5's Carolina Cruz spoke to two patients who are hoping to find healing.
The effects of COVID-19 forever changed Anil Gallwalker's life.
I just didn't see it coming and affecting us the way it affected me.
Anil contracted COVID-19 April of 2020 while on the road as a regional truck driver.
Life just stopped at that moment. Things just changed.
He's battling symptoms a year later.
Every time we go in, it's another hit.
Doctors at the University of Kansas Health System have been treating him. He's one of the first long hauler patients.
Now that we are a year into this, we're seeing a bigger influx of patients. And some studies have reported up to a third of patients who have COVID can experience symptoms that linger for more than a couple of months.
The hospital system's long hauler clinic opened early this year. It's now expanding to meet demand. It's virtual, which allows 15 physicians from 8 specialties to treat patients across the Midwest. They are adding more specialties as they discover more long-term symptoms. Terry Geller is a patient candidate in spite of being an active 59-year-old.
Good, and she just said, unfortunately, you're a long hauler.
Terry followed protocols, but her family was exposed at a small family gathering in October.
Symptoms continued for 5 months.
Body aches, brain fog, chest pain.
So I couldn't figure out why these were lingering.
After getting a COVID vaccine, most of Terry's side effects lifted, something Dr. Keith Sale, who treats patients with lasting symptoms, says is being studied.
It is encouraging that for some of these long hauler patients, the vaccination process may be a way to begin to see some relief from some of their symptoms.
Terry hasn't regained her sense of smell or taste.
It's juicy. That I can get. It's juicy. Not much flavor, though.
What little she has is distorted, causing food to taste bad. Part of her therapy includes reprogramming her brain to regain those senses. Doctors are learning more from each patient experience, dating back to Anil.
With what they know now, they probably are a lot better than they were then.
Carolina Cruz, KCTV5 News.